Today's video is going to focus on lead poisoning detection and prevention in children ages 0 to 7. Our teaching is directed towards the parents of the children at risk for lead poisoning. The community we have focused on is Norristown Borough. By the end of this teaching session, the learner will be able to identify at least 2 sources of lead poisoning, name at least 3 signs and symptoms of lead poisoning, state at least 2 prevention methods for lead poisoning, and identify at least 1 source to contact if a child is suspected of having lead poisoning. What is lead poisoning? It is one of the most common childhood poisonings and is 100% preventable. Lead is a metal found in the earth that is used in a variety of products. It can be breathed in, swallowed, or absorbed through the skin. When levels of lead reach 10 micrograms per deciliter or greater in the blood, it is considered lead poisoning. Who is at risk for lead poisoning? Lead poisoning can affect anyone, but children ages 7 years and younger are at an especially high risk. Children tend to put things in their mouths and eat non-food items and play outdoors, which makes them more likely to ingest lead. Their undeveloped muscles, bones, and nervous system, including their brains, can be severely damaged by lead. Children from low-income families and minority children have been shown to have greater incidences of lead poisoning. What is the prevalence of lead poisoning in Norristown? Norristown has a large percentage of older homes which are more likely to have lead-containing paint. In 2011, there were 54 known cases of lead poisoning in children less than 7 years of age in Norristown. The rate of lead poisoning is 40% higher in Norristown than the state average. Pennsylvania also has a significant amount of older homes. 70% of homes were built before 1978, and 36% of homes were built before 1950. The importance of these dates will be discussed in the next slide. Sources of lead paint. The most common source of lead is lead-based paint. Lead was used in paint for many years, but was banned in 1978. Paint in homes built before 1950 are the most commonly likely to contain lead paint. Lead-containing paint is more dangerous when it is on the outside of the homes because it wears off over time into the soil and water surrounding the home. Lead paint chips may be swallowed, but it is more common for children to ingest lead particles through contaminated soil and water. There is an increased risk for contaminating soil during renovations of older homes, such as repainting, remodeling, removing old paint, or demolition. There are many other sources of lead that children may come in contact with. As discussed before, water and soil can contain lead. Old pipes also contribute to lead in water. Other sources include old toys or imported toys, art supplies such as pottery glaze, cosmetics, batteries, fishing sinkers, and ammunition. Factory emissions can contain lead, but levels are strictly monitored by the Environmental Protection Agency. Factory workers can also bring home lead particles on their clothes and shoes and expose children to lead. Some home remedies such as Greta and Azarcon are dangerous and should not be used because they contain lead. Shields used in medical facilities to protect against X-rays also contain lead. There are many signs and symptoms of lead poisoning that can easily be mistaken for other illnesses. Things to look for in your child include poor attention span, hyperactivity, or an unusual amount of irritability. Children may complain of stomach pain, poor appetite, a metallic taste in their mouth, or nausea. They may begin to vomit or not be able to have regular bowel movements. They might have muscle and joint pain or headaches. They may appear more tired than usual and have pale skin. Children with lead poisoning can have seizures and lose consciousness. Lead poisoning can affect a child's entire body. Growth is delayed, leading to shorter height and lower weight. Children may show poor muscle coordination. production of red blood cells is decreased, leading to anemia. Red blood cells are important in transporting oxygen through the body. Kidney damage may also occur. Kidneys are important in filtering out toxins in the blood, so damage to kidneys can lead to increased levels of toxins in a child's bloodstream. Lead poisoning has been shown to cause permanent brain damage, leading to lower IQ levels, difficulty learning, behavioral problems, and hearing loss. Death can also occur from severe lead poisoning.
Detection and diagnosis. Diagnosis of lead poisoning is based on the signs and symptoms. However, many of the signs and symptoms can indicate other diseases. This is important, then the doctor has to decide if lead poisoning is there and a test will be done. Who to contact if suspected lead poisoning. When calling the Poison Control Center, it will automatically connect you to the closest center near you. It is a 24/7 service that is available via phone. You can call the next number, 1-800-440-LEAD, or the Bureau of Family Health. Treatment of lead poisoning. Sometimes a well-balanced diet full of iron and vitamins may be enough to eliminate lead poisoning. If a good diet is not enough, chelation therapy will be used. Chelation therapy is given through IV and draws the metals from the bone to the blood. Frequent testing of lead levels is done during the treatment. Also, if lead level is suspected to be ingested, bowel irrigation or gastric lavage, aka stomach pumping, may be used to remove the lead from the stomach. Prevention is the best treatment. Because lead poisoning is common in children, it is important to make sure toys your children play with are safe. When buying crayons and paints, they should read ASTM D 4236. This indicates that these supplies have been evaluated by the American Society for Testing Materials. Know your surroundings and the area you live in. Prevention for everyone. There are screening programs. Hand hygiene is also one of the most important and eliminates possible contamination. Know where your house is built and inquire if there were lead removing measures made. Also, a proper diet filled with vitamins and iron is very important. Now that the presentation is complete, you should be able to identify the following objectives. Identify at least 2 sources of lead poisoning. Name at least 3 signs and symptoms of lead poisoning. State at least 2 preventative methods against lead poisoning. Identify at least 1 source to contact if a child is suspected of having lead poisoning.